don't know if Dr. Henry would be the one to answer this or if Minister Dix would be. Wondering what immediate short-term solutions are available or currently in place to address staffing strain in Kamloops and to assist our healthcare workers at Royal Inland Hospital.
Yeah, thank you, and thanks for the question. I think that our teams at Royal Inland Hospital, like in a lot of hospitals across BC, are facing real challenges. Today's hospital occupancy is 117% in Kamloops, which is obviously not desirable. It's a significant pressure on the hospital. Everyone will know, as of Saturday, I don't have today's statistics, as of Saturday, there are 32 people with diagnosed with COVID-19 at the hospital, which is a very significant number, obviously, and a significant subset of that, I believe 13 at that time, was in critical care on Saturday. So those are significant challenges facing the hospital. Some of these issues aren't new. Earlier this year, far before this, we put in place a significant number of measures. We invested more than $1 million in new funding to the emergency department staffing this year, and two new full-time nurses are completing orientation this week. Since June 5th, 9 new staff have joined the emergency department, including 5 permanent full-time. We're also making significant steps right now, working with other groups throughout with all the players and all the people who are involved around Royal Inland Hospital. It's a significant challenge, but we've taken a series of measures this week to support with agency nursing, to support the management of the hospital with new staff to provide support for that. Our IHA president has taken a significant role in that, Susan Brown, as you will know, and that involves all the things you would do, enhanced support for discharge planning, because one of the key challenges in the emergency room when the hospital is full is you can't, it's much more difficult to move people up to the wards when the wards are full. So we're doing that review of long-stay patients, discharging where possible to long-term care, early discharge of patients who we can provide services at home. Obviously, the steps we've taken that I described earlier with respect to the postponement of non-urgent scheduled surgeries, that we've added, supports both at the physician level and the staff level, and of course we're continuing to do all the centralized recruitment we're doing in Kamloops. Kamloops is an important priority, and everybody knows this. One of the real challenges facing the hospital is this is a huge year for Royal Inland Hospital. You know, we're moving to the new tower next year, and so a significant work is being done on that, and what we've tried to do is take that work and provide that work over to someone new in order to, on the management side, to support the team. In short, actions in the short term, actions taken before the pandemic, support for our workers, and still there are challenges. We've heard a lot of stories about it. There are about 1,037 nurses that support activities at Royal Inland Hospital. And in the month of August, exactly 13 nurses left the hospital who were in that, and there's a regular movement when you have that many people working, of which 10 took other positions in interior health and 3 left the health authorities and effectively resigned or left and are doing something else or retired. So I think our teams have, under very challenging circumstances, are doing very strong work, and in all of those areas, all of those actions, we're giving the priority to Royal Inland Hospital that it deserves. It's an important hospital, and I think what we have to do in the midterm, we've built the new hospital. We're adding services and support services to Kamloops. We put our first urgent and primary care center in Kamloops. We've added surgeries, we've added support, we've increased hours for diagnostic services, and all these things will represent challenges. It's an important hospital, and over the last number of decades, as you know, the hospitals around Kamloops, who serve other areas, have seen, while Royal Inland has got bigger, have seen reductions in services. That tends to flow demand towards Kamloops. So these are longer-term responses that we've put in place. But you know, it is a very challenging position. 117% is a lot, and there's real stresses on our nurses and our doctors and our health science professionals and our healthcare workers. And I want to encourage people, everyone in Kamloops, to respond to this, because a portion of it is to do with COVID-19, that's for sure, is that it's really important that people get vaccinated. We know that number is about 83% across the 2 community health service areas that serve Kamloops, but it can always be higher. And at a time when there's such a high rate of illness amongst unvaccinated people, it's really important that we continue that efforts to do it. There's something in our hands to be able to continue to do that, and I encourage everyone as well to get vaccinated and to support the really courageous and extraordinary work being done by healthcare workers in Kamloops.